Today, we will focus on climate and health and the impact of climate change on human and community health, and the role that you as youth climate advocates can play in mitigating climate change and promoting health outcomes in your communities and globally. So we're very, very, very privileged to have two incredible speakers with you today. Kimberly Humphrey. Kimberly is an emergency physician and public health medical consultant for the South Australian government, leading work in climate change and health focused on mitigation and adaptation for South Australia's health system. And Tess Wiskel. Dr. Wiskel is an emergency physician and a graduate of Brown University Emergency Medicine Residency Program and the University of Chicago Pritzker School of Medicine. She has centered her career on improving care for at-risk populations, both locally and globally. So Dr. Wiskel and Dr. Humphrey are Climate and Human Health Fellows at Harvard, which is a program that's run in collaboration with the FXB Center for Health and Human Rights, the Beth Israel Medical Center, and Harvard Sea Change Center. And we're really privileged. Both of them were just at the COP and in Egypt. And we shared with you the link to the webinar that they gave last week through the FXB Center. So I think some of you may have had a chance to watch that. And we're just really grateful that Dr. Humphrey and Dr. Wiskel will share with us today an overview on climate and health, and then take your questions as well around this issue. So I will turn it over to you. Let's see.
Wonderful. Thanks,
Karina. Are you together in one room?
We are not.
Oh,
no.
okay.
Tess is online, though. I can see Tess as well.
Yes, hello.
Hi.
Thank you so much for having us.
Agreed. So we've kind of put together a presentation and split it between both of us. So we'll both step in, but please ask us questions anytime. And we've left plenty of space for questions at the end, both about our career trajectory as emergency physicians now working in the climate space. As I know some of you are students and some are a range of ages. So please ask us any questions about that, as well as our experiences at COP or anything else that you want to know about climate and health. And then I think we'll just get started with the presentation here first.
Great, thanks, Tess. And as Tess said, so we're keeping it relatively brief, still giving you a bit of an overview of climate and health in the essentials, but leaving lots of time for your questions and the things you want to explore as well. So I will start off. I'm going to try and share my screen, and then I will hand over to Tess when I've done my part. So let's see how we go here. All right. Can everybody see that?
Yes.
Perfect. Let me know if the slides do not work when I'm talking.
Yes.
Yes, we can hear it. Thank you.
Okay. All right. So I will not go into the science in any great detail because I know that's been covered for everybody in this work before, but just briefly to mention the Keeling curve showing the carbon dioxide concentration. We know that it's going up, and we know this isn't just natural cycles of warming either. This is caused by us, it's caused by humans, and clearly has escalated significantly since the Industrial Revolution in the world. So that's just something to keep in mind. And once again, we know that even with our current policies, we are on track for about 2.7 degrees of warming globally. If we did nothing, it would be about 4, but we are certainly not where we need to be with targeting that 1.5 degrees Celsius. Now, this is just a little picture to show why that's important. So one of the things that I hear is, what's the big difference between 0.5 and 2? It's half a degree. How is that significant? On any day, if you're outside, half a degree doesn't feel that pronounced for us. But in terms of the impacts in the world, it is hugely significant. So every 0.1 of a degree is going to make a big difference in terms of what happens to our planet and our people. If you look at this diagram here that I have on the right-hand side, the difference between 1.5 and 2 degrees is 2 times greater loss of plant species. It's 10 times greater loss of sea ice-free summers in the Arctic. It is hugely, hugely significant in terms of increased extreme heat. So that would be over 2.5 times worse. So everything we do to limit warming by 0.1 of a degree is just hugely, hugely, hugely important. And this is why we need to keep heading for that 1.5, which is still feasible. We can still do it. We are still in that window and we need to get there. All right, now it's stopped tracking for me. Let me see, there we go. So the health impacts of climate change, which is why we're here today to talk about this with everybody. Climate change impacts every aspect of health. Absolutely everything about health is impacted by climate change. This is a diagram that is a favorite of most people I know working in this space because it really just encapsulates the whole intersection between climate and health. So rising temperatures, extreme weather, rising sea levels, and increasing carbon dioxide will impact through severe weather, air pollution, water quality, food security, extreme heat, allergens, a whole plethora of other things. It will worsen things like respiratory disease, so asthma, heart disease, infectious diseases like malaria and dengue, and many others will get worse. We will see more diseases related to poor water quality and water security. Malnutrition will get worse. Forced migration, civil conflict will have mental health impacts, injuries, and other implications as well. And heat-related illness and death is huge. It's one of the biggest things that we see that climate change is worsening in terms of health. It's really important as well to realize that climate change disproportionately affects certain countries and populations as well. So this is a picture of the vulnerability of different countries to the impacts of climate hazard. So you can see that not all countries are affected the same. I'm from Australia, currently living in the US. If you have a look at this diagram and the vulnerability key that's on the right-hand side there, they're both relatively low in terms of vulnerability. Whereas if we have a look at Africa, that's very high to high, and certainly parts of Central and Latin America are also in that category, and the Pacific Islands and much of Asia too. All of the world will suffer really pronounced impacts because of climate change, but some countries are going to suffer more than others. And what we will see as well is often it is not the countries who have high carbon emissions who are going to suffer the most. It is the countries who do not have high carbon emissions who are going to suffer disproportionate impacts on their health from climate change. So it is not fair. Within countries, we will see disproportionate impacts of climate change on different populations. And certainly we already see this. So communities of color face increased risk from pollutants, they face increased risk from heat. Older adults, low-income communities, children, and people living with chronic diseases all will suffer greater effects on their health than others. This is the future of heat waves. So I'll talk a little bit about heat, and then I'm going to hand over to Tess to cover some of the other health impacts. But this is the number of days projected to exceed potentially deadly heat levels by 2100. So South America, Africa, Asia, the top of Australia, just really, really significant numbers of days in the year that are going to have severe heat. We will see increased frequency and increased height of heat waves going into the future as well. The 5 warmest years on record are 5 of the most recent years, and at least 9 of the 10 warmest years have occurred between 2005 to 2019. So heat is one of the biggest killers related to environmental effects worldwide now. And it's something that we really, really need to be thinking about how we improve our coping with this. So more than 300,000 deaths in 2019 related to heat. They are increasing by 75% nearly since 1990. Extreme heat increases the number of people who come to emergency departments, who end up in hospital, who die from heart disease and other illnesses, who have mental health problems. Pregnant women are affected more, and it's making healthcare more expensive. So heat is not just heat illness, which is when somebody goes out in a hot day and they get that kind of obvious, we might see they're dehydrated, they might pass out. There's certainly other more severe impacts, including death from that, but it affects things we might not even think of. So it can cause people to have heart attacks, for example, and to present to hospitals. They will present to hospitals with worsening of their mental illness. Many medications are affected by heat. Many medications people are on make them susceptible to not dealing with heat within their bodies as well, and they come to emergency departments. So heat is hugely, hugely important in terms of what we need to do to deal with climate change health impacts. These are some of the things I just mentioned. So it's not just the obvious things. It really has really profound, wide-ranging effects on people and health systems. This is just briefly mentioned about humidity. So the wet bulb temperature is the measure of the ability for water to evaporate and therefore for the body to cool down. So sweating is the best way that our body deals with heat. When it's very humid, sweat does not evaporate and it doesn't cool our bodies. So humid temperatures have these very profound effects on people. And apologies for people like myself who like to read in Celsius. That's a Fahrenheit chart there on the right, but that is from the American College of Sports Medicine, which is discussing about when you should not even be attempting to practice sport or work outside, because that wet bulb temperature is just going to mean that your ability to cope with heat is going to be so much less. So it's not just about how hot the day is, it's about how humid it is as well, and your body's ability to deal with that. All right, very quickly, I will go through this case. So this is a lady that I saw working as an emergency physician in my department in Adelaide. So she was 34. This happened a couple of years ago, where it was a 46.6 degree day, which is 115 Fahrenheit. We get days that hot somewhat regularly in Adelaide. And generally, if you talked to people who are privileged, who have air-conditioned houses, air-conditioned cars, they might not even remember this day at all, because they have, the infrastructure and the money to be able to deal with it. This lady came into the emergency department with heat-related illness. So she was dehydrated. She was very tired. She wasn't suffering the severe effects on the spectrum where we would see things like altered mental status. So she'd be more confused or go into a coma or things like that. But she certainly, it was easy to make the link between the heat and what she was coming in with. She was very dehydrated. She had walked for 2 hours in that heat to get groceries. Now, one of the things that really struck me about this case was a number of people I was working with in emergency said, why would you do that? That is just silly. It is so hot. You need to stay inside. That's very easy for people who have access to air-conditioned cars or the money to get delivery to say. This lady did not have a car. She did not have any money to get a bus. The only way she could feed herself and her family was to walk. So she did not have a choice. Climate change disproportionately affects people like this woman who have poor social determinants of health. If you need to work for a living and your work is outside, then you go to work when it's hot. If you need to get groceries and the only way you can get groceries is to walk for 2 hours in the heat, then you do that. When we are addressing the health impacts of climate change, in many ways, specifically in this case, heat-related illness, we need to be looking at the social determinants of health. And that is things like people's ability to earn money, where they live, what their background is culturally. All of those things are things that come into this equation as well. This is just to say that urban heat islands are areas without trees. And we know that they can be up to 4 degrees Fahrenheit hotter than places that do have trees as well. So in our cities, it is hotter than the places on the urban edges that are well greened and well forested. And there's a lot to be said about greening our neighbourhoods to prevent the impacts of heat illness as well. Inequitable impacts of heat we've talked about. So all of these things, sociocultural factors, individuals, the old, the young, different ethnic groups, those who work outside, and people who have physical problems, including mental health conditions, will suffer more from heat than wealthy people who can afford to air condition their houses and drive around in their air-conditioned cars as well. So that's something we need to think about when we are considering health impacts of climate change. It's not just heat. If we picked apart any health condition that is affected by climate change, we would find that all of these things play into it as well. And it's not just about addressing the impacts on people's health, it's addressing the underlying causes and making them more resilient and more able to withstand the effects of climate change on their health. This is my last slide. So this is my favorite, one of my favorite slides of all time from the BMJ. I love to bring this out every talk I do. This is about the co-benefits of climate change. So climate action does not mean that people need to suffer. That's a rhetoric that I had seen repeated a lot in the past. That is, you need to sacrifice for climate action. You can't do fun things and live a good life. Well, you can actually. Your life will be better if you adopt these things in regards to climate action. So active transport, eating a healthier diet, having a greener neighborhood, all of these things lead to better mental health, less diseases, lower rates of obesity, happier people, good for the environment, and it's good for health as well. So that's why I really love this slide. It's good, it's positive, it's win-win for everybody. All right, and that is me. So Tess, would you like me to stop sharing and you can share your screen?
I think that'll be easier. Let's try that and see if my share screen works.
Yeah.
Thank you, Dr. Humphrey.
Thank you.
So let's see what we got, if I can figure this out as well.
I made you co-host, I believe.
Thank you. Yes, I can see that that's happening. Let me just make this slideshow. And I'm going to share screen. Let's go here. All right, is everybody seeing that?
Yes.
Perfect. All right, so we were talking about how we're both emergency physicians, and I think that's really important because it really informs a lot of the work we're doing in climate change. So I also want to start with, and really it's seeing the impacts on our patients that make us want to do this work. So I want to start out with a case I saw when I was working in Philadelphia. This was of a 51-year-old male that presented with an infection. He was homeless, and we had just had record rain and flooding after Hurricane Ida. This was last year, and you can see in this image, this is the main freeway going through Philadelphia, completely flooded, as well as many of the other streets, and many people evacuated from their homes. And this is in a well-developed city in America, and it's still this much flooding after this hurricane. So he came into my emergency department, not doing well, disheveled and distressed. And he had this really stinky feet and with like bugs crawling, and it was really affecting the rest of his body. His heart was going fast. He had a fever, and we're seeing from the rest of his workup that we were doing in the emergency department that he had an elevated white blood cell count and lactic, which are signs of severe infection. So what he had was a necrotizing soft tissue infection. We gave him IV hydration and antibiotics, and he needed surgery for this infection on his feet. And this is one of the things that we're seeing after floods is these bad soft tissue infections. And this is just one case, but he also tends to affect, like Kimberly was saying, people at greater risk, like people that are homeless. So flooding is one example of extreme weather, but besides just flooding and storms, there's wildfires, droughts, and heat waves. And these all have health impacts. And we have attribution studies saying how much of this extreme weather is related to climate change. And we know that in studies from 2019 to 2021, climate change worsened 84% of these different extreme weather events. These extreme weather events are having health impacts that range everywhere from injury and death to mental health exacerbations of respiratory and cardiovascular disease, and infections like the patient I saw, as well as GI infections. And that's just beginning of the list. And then these are also having impacts on our health systems. So they're causing infrastructure damage, lack of medicines and access to care, and overwhelming our health systems. So we're seeing this increased precipitation during storms. So climate change is making the amounts of absolute precipitation go up significantly in storms. And you can see just these images in the US of how it's changing first initially from 1900 to 2016 to now 1958 to 2016. And the heaviest storms are getting worse. So this is causing a lot of different health impacts. So the first image is kind of how storms are blowing allergens. And this is going to cause exacerbations of asthma and other respiratory disease like COPD. We're also having contaminated water. This will cause things like the infections when somebody's walking through this contaminated water, like the soft tissue skin infections, but also potentially contaminate water supplies. And that can lead to a lot of different infectious diarrhea. And then there's housing damage. So this will cause direct trauma from the actual impact on your housing itself. Will also cause homelessness and evacuations, which can have impacts on mental health and access to your care, and cause issues with allergic molds and toxins within the house. More than just these direct population health impacts, however, we're seeing that there's longer term impacts as well from the weather impacting health systems. So this is a study with colleagues at Harvard on the mortality after Hurricane Maria in Puerto Rico in 2017, which really devastated Puerto Rico. One of the big things this study showed was that although the official death count was 64, through household surveys afterwards, they found that the actual excess deaths from this storm were over 4,600. So very different from the official death count. And this was done through household surveys. The graph on the left shows how many people migrated after the hurricane itself, with 50% going elsewhere. Of the people that migrated, which were thousands of people, 50% went elsewhere in Puerto Rico and 40% went to other places. And the graph on the right shows some of the impacts on utilities. So water, cell phone coverage, and electricity were all lost for many days. You can see going up to 125 days after the storm, and worsened the more remote the people were. The second image in this shows how many households were unable to get medical care. So unable to get medicine, unable to use their respiratory equipment, roads damaged and facilities closed, people unavailable, couldn't get 911 service. And this was a substantial impact to these excess deaths, where the majority of the excess deaths were from interruptions in medical care after the hurricane. Not just the direct trauma, but all of the issues afterwards from these loss of basic utilities and lack of access to care. So that was storms. We also know that wildfires are increasing. So this is from the Lancet Countdown Report. And from 2001 to 2004 to now 2018 to 2021, we see the risk of wildfires and wildfire days increasing in 61% of countries worldwide. So we know wildfires are increasing, and they're increasing in their severity and in the frequency. We know this has an impact on health. So this study looked at wildfire-related particulate matter that's released around the world. They looked at something called PM2.5, which are small molecules that cause pretty significant health effects. And this study estimated the worldwide exposure to acute particulate matter 2.5 after wildfires, and looked at the acute effects after the wildfires. And you can see that it increased both all-cause mortality, cardiovascular mortality, and respiratory mortality around the world. And this is similar to when you compare the results to the local studies in Europe and Canada that showed similar results, kind of verifying the validity of this, and that it's worsening with worsening particulate matter concentrations. So we know wildfires are also affecting our health. Additionally, we know that there are these health system impacts of extreme weather that are significantly impacting our health from power outages. So this is going to impact electricity-dependent medical equipment. It's also going to impact food that people need to survive, and medicines that need electricity to keep them cool, like things like insulin. That's a life-sustaining medicine. The second image here is showing an evacuation after a wildfire, but we're getting evacuations after extreme weather. And this is going to impact the people being evacuated, but also going to change the access to care and the overwhelming visits to other systems. And we're seeing infrastructure damage. This last picture is after Hurricane Sandy at Coney Island Hospital. And this is months later, and you can see that the facility is still under repair and therefore not able to admit patients. But besides just the direct infrastructure damage to the healthcare facilities, it's also damaging supply chains. And all of this is going to make it harder to get the care people need after extreme events. So the other big thing to talk about is how extreme weather is driving migration. So this is an image from the IPCC reports, which is basically the UN group that brings scientists from around the world that look at the best science on climate change. And this is from their latest reports, and it shows the weather-related internal displacements, and that the extreme weather is displacing about 20 million people every year. If you look at this, you can see the blue is the largest bar, and that's storms and floods. So really it's tropical cyclones, particularly in East and Southeast Asia, the Caribbean, the Bay of Bengal, Southeast Africa. And these are causing involuntary internal displacement. And obviously there's lots of different reasons why people are being displaced from the extreme weather, but then how much it's actually damaging housing and livelihoods, and then what the response is of government and humanitarian agencies, and all of that's going to affect the migration. But we can see that it's definitely driving migration. And then this is from some work we're doing here at Harvard with the team at Crisis Ready and looking at human mobility in response to extreme weather. So this is an image of human mobility after Hurricane Ian that happened just earlier this year. And you can see this is an image of Florida. And what we're taking is mobility data from Mapbox and Meta that show patterns of migration. So you can see here right along the coast where the storm's about to hit, this big circle is the storm. And then right along the coast where the storm's about to hit, you can see a decrease in population density over 50%. So that's the little red dot, went back, the little red dots. And then increase in population density further away from the storm, that's the blue dots. And so we're mapping how people are moving, and we're mapping this both with vulnerability, so both poverty levels and age as a marker for vulnerability, as well as with power outages and with infrastructure. So where we have healthcare resources and where we have other resources, and using this to try to see how to help with relief agencies to direct response, and use this with public health agencies, relief agencies, and governmental agencies to see what's happening with these storms and where we can most effectively take care of people afterwards. And this is just one example, but we're doing this for extreme weather events around the US and around the world. So that's extreme weather. So I want to talk a little bit also about vector-borne disease, which is being impacted by climate change. So I'm going to start with another case. So this is when I was actually working in Maine, and I had a 63-year-old female presenting with a fever and a rash. This is an image of the rash. This isn't her, but this is a representative image. And the image on the right is from the hospital that I was working at. And it was October in Maine. And she had a fever and a fast heart rate and this rash. We sent lab work up. But basically, based on this rash, it's basically a pathognomonic rash for Lyme's disease, this bullseye rash. So I gave her fluids and fever control and started her on our standard treatment for Lyme disease, a course of doxycycline. So the reason I talk about this is because we know Lyme disease is significantly increasing because of climate change. So here's a general pattern from 1996, where I was in Maine is like up here at the tippy tip in down east Maine, where you didn't see as many blue dots of where Lyme disease was, especially later in the season. And then you can see later in 2018 that there's way increasing cases of Lyme disease. And my patient was in about 2020. So the Lyme disease is a vector-borne disease. That is carried by the spirochete, that is caused by the spirochete Borrelia burgdorferi and carried by the deer tick. And it's very climate sensitive, as the deer tick itself is strongly influenced by temperature. And we see climate change impacting the suitable tick habitat. And really, it's sensitive to long-term changes in climate. So we know this isn't just one warm day or one warm month, but it's the overall changing. And we know that climate change has expanded this range, with the incidence of Lyme disease doubling here in the US. We see other vector-borne diseases increasing as well. So arboviruses, which include dengue as shown here, but also chikungunya and Zika, are having increases in their basic reproduction number as a proxy for the increase in cases. And we see these increasing by about 12% over time. Here showing dengue, but about similar for Zika and chikungunya. We also know that the length of the transmission season for malaria is increasing by 31% in the highlands of the Americas, 13% in Africa over this time period. And we know that this is with increasing global temperatures, but also with precipitation and humidity. And we can respond to this though. So we know that the vectors are changing. So both the Anopheles mosquito carrying malaria, but also the ticks. We know that the seasons for transmission are lengthening. They have an expanding range. The environment itself is changing. So increased rainfall and flooding leading to breeding habitats for mosquitoes. We know people are moving. We just showed the pictures of migration, and that's making them exposed to different diseases, and they may not be used to. And we know cities are moving too, where they're expanding closer to natural environment. And all of this is changing our vector-borne diseases. But this image on the right is showing a teaching system that session that I was at for mosquito nets in Uganda. And there's a response we can do for this. So this is education on preventive measures, including bed nets for mosquitoes. But we also have other things like increasing surveillance of these vector-borne diseases, developing better treatments and vaccinations for vector-borne disease. So there's a lot we can do to affect change and to respond to what climate change is doing to vector-borne disease. So we also know that our water supply is changing from climate change and is causing more waterborne infections. So we have there's a lack of access to clean water. This is from changes in precipitation, the stormwater runoff we talked about earlier, but also changes in the salinity from saltwater runoff with increasing sea levels and increased temperatures affecting water supply. We're having increased algal blooms in certain areas, lack of safe drinking water. And this all can lead to infections from waterborne pathogens. This is everything from viruses like norovirus to bacteria like salmonella and protozoa like giardia. And we know that these cause hundreds of thousands of deaths and infect millions of children worldwide by statistics from the World Health Organization. One example of a particularly climate sensitive disease is Vibrio, which is illustrated in the graph on the right. So Vibrio infections are linked to coastal environments and eating undercooked shellfish. And they cause about 50% of shellfish related illnesses annually. Vibrio is particularly climate sensitive as it lives in water that is sensitive to change in temperature, as well as precipitation and salinity and sea level rise. And here you can see how with climate change, there's coastal areas that are more suitable for Vibrio outbreaks are increasing in these three areas. And these areas have high amounts of Vibrio already, but we also see that there's increase in Vibrio penetration, especially in northern latitudes where they did not used to be. And Vibrio causes everything from a GI illness with vomiting and diarrhea to skin infections and overwhelming infection. And it's a particularly climate sensitive disease that there's a lot of studying going into now. We also know that our food supply is being affected by climate change. So there's a lot of different reasons for food insecurity, not just climate change, but we know conflict is causing food insecurity, such as the conflict in Ukraine right now is causing large changes in food security, but also pandemic restrictions. But climate change itself is also causing some impacts from the precipitation changes, extreme weather knocking out crops, droughts, changing in pest patterns. All of this is causing decreasing food production, declining nutrients, and then heat waves are causing labor hours lost. We know that from the heat in 2021, there was shortened crop growth seasons, about 9 days for corn, but also for other sorts of food. And these increased heat wave days were associated with 98 million people reporting moderate to severe food insecurity. And there's a lot of different health effects from this. This is an image of malnutrition, one of the main health effects from food insecurity and not having a significant good food supply. But it's also going to exacerbate infections and chronic diseases and make really all health impacts worse by not having a good food supply. And then we know that there's migration from the environmental degradation. And here's an image, a very famous image of migration and asylum seekers off the coast of Africa. And again, migration is multifactorial, not just climate change, but it's one of the factors leading to it. But there's also destruction of homes from climate change and changes in livelihoods of what you can do or not do because of climate change. Parts of conflicts are contributed to climate change, such as when there's increasing competition for food and water and natural resources and extreme drought that leads to conflict. And then the migration can cause stress on the healthcare system. So when people migrate, they may not have access to their regular care. They may not be able to find new care. And all of this is going to exacerbate health outcomes. And I know somebody was asking about mental health earlier, but mental health is one of the big things affected by climate change. And we've seen both short-term effects and long-term effects after climate-related events. This is both the acute stress response to the events. There's loss of community when people are being displaced. We see increasing levels of anxiety, depression, PTSD, but also suicidality and substance abuse. And we also see that this is in the communities most impacted. So the elderly, people with pre-existing conditions, pregnant women and children. And we've also seen studies showing that how these impacts will persist for years after an event or a displacement related to climate change. So finally, what can we do? So we have climate drivers, or the climate hazards that are causing this, like our flooding, our increased temperatures, our extreme weather events. That's leading to exposures to people and the health outcomes. And all of this is affected both by your environment and the social context. So we can mitigate. So we can think of ways to decrease climate change, from mitigating greenhouse gas emissions and decreasing the problem itself. So that's going to help impact the climate drivers that are causing these related health impacts. And then we can adapt. So we can adapt to both what's happening to the health impacts. So if there's worsening infections, we can adapt by improving the treatments. We can adapt to the extreme heat by not going outside, thinking about staying inside, or thinking about ways to cool. And we can also look at health equity and how this is affecting different people differently, and focus on those populations and make sure that there's a way to make this a health equity issue, and think about what we can do to improve health equity through our adaptive changes for climate change. And then we've got some resources and our contact information. And let me end the show. Thank you, guys. I'm going to try to get back from the slide sharing now.
Thank you so much to both of you for such an informative presentation. So I have my first question. I'm sure our participants are thinking, well, both of you are doctors. How did you get into climate advocacy? Can you share a little bit about your climate stories and how you ended up as emergency room physicians who are also climate advocates? And hopefully that may inspire some of our participants who are considering a career in medicine, but maybe don't think it, combines well with the climate advocacy they're doing right now as young people.
Absolutely. And I'll go first to give Tess a bit of a break after that wonderful presentation. So yes, I often get the question, what does climate change have to do with health? And then secondly, you're an emergency doctor. What on earth does that have to do with climate change? So my journey is I was not very active in the climate space when I started my residency in emergency medicine, but more and more and more, I saw patients in my everyday work who were affected by climate change. And I worked throughout Australia. So I worked in the outback of Australia. I worked in the tropical north of Australia. And you would see different impacts on patients depending on where you're working. So in the outback, we saw extreme heat more than they would get. And they're very resilient populations out there who are used to this. But the worsening impacts of that, to the point that they haven't adapted to that. And it's clearly different than the usual heat that we've gotten for years. More wildfires, really substantially in Australia at the end of 2019 and 20, we had quite catastrophic fires. And Australia is a country that has fires. We've always had fires, but not like we have now. And so it was very obvious in my clinical work that climate change was impacting patients now, and it's not in the future, and it's not theoretical, it's already happening to us. And it's very relevant as somebody who works in emergency medicine. And the emergency department is the front door of the hospital. So we don't turn people away. We see people who present with absolutely every medical condition, who come from every walk of life, who are sleeping rough, who don't have money, who come from marginalized communities, who are suffering more from climate change. They all come to see us in the emergency department. And not only do we see those impacts and they're obvious to us, we also see what we can do about it as doctors too. So to me, that was very striking, the patient in front of me and how I need to help them. But then what do I need to do on a bigger scale to think about mitigating this problem, and also what we need to do to help our communities and health systems be more resilient as well. So there's an awful lot we can do. And as doctors, we have power and privilege in our communities. And not all of my colleagues would agree with this, but I feel if you are a doctor and you have that power and privilege, then you have a duty to do something about it and to help those people in communities who are really struggling because of climate change. So that's very briefly how I got involved in this.
Thank you so much. How about Dr. Wiskel?
So I agree with it really being seeing our patients in the emergency department. And I think there's something to be taken into account of we're both emergency physicians, because we do particularly see how the social determinants of health are affecting our patients in the emergency department. There is no kind of in between. Like, we see them immediately coming from their home in a heat wave that doesn't have air conditioning that they're trying to go back to, or from the streets. And you can see those social determinants of health particularly being magnified by climate change. And I think that's what makes me particularly interested, is instead of just treating like the heat stroke or whatever other thing happened that day, it's looking at what's causing the person to be brought in there and the greater public health issues. And I think that's what made me want to get interested in climate change in itself. And I think I'd always had an interest in taking care of kind of the patient, these social determinants of health, and I did different work. But I think over time, we're seeing more and more impacts that are clearer and clearer from climate change. And I've also worked in multiple different settings, both in the US and outside of the US, and seeing it in different ways. And I think that's what's drawn me towards climate change in and of itself. There's reports from the Lancet saying it's the greatest public health threat of the 21st century. And I really think that's true because it impacts health in so many different ways. And I think that's why the focus on what's bringing patients in, why climate change is such a big one. And then there's the personal side as well. So I'm originally from California, and we've had devastating wildfires in California in a way that never happened when I was growing up. Like, I remember there being high wildfire risk at times, but it was never to the way it is now, where I've had friends and family evacuated from houses, sometimes more than once from the same community because of these fires happening. And that personal side too made me think of like how this is impacting my patients when it might not be clear. and is part of the reason that I got involved in this work.
Thank you so much. So I'll just ask one more broad question before turning over to our participants' questions. So if this is the public, climate change is a public health emergency, what are some policies at the global, national, and community levels that we need to see in order to address it as a public health emergency, and not only the destruction to the natural world, which of course is also part of it? And a subpart to that, since both of you were at the Conference of Parties in Egypt, did you feel like the climate and health angle was, up in front on the agenda of the climate change discussion?
Yeah, absolutely. So yes, I guess it's a complicated issue. So the answer to your first question, there's many parts to that, I think. So addressing the health impacts of climate change is multi-sectoral as well. So we need to look at both mitigation and adaptation. So part of addressing the health impacts of climate change is looking at carbon emission policies from a national level. So it's not just about what the health sector does, although it's an important point that if you look at all of the health systems worldwide together, they would be the 5th largest country in terms of carbon emissions. So there's a lot we need to do to clean up our own backyard. Both Australia and the US, in each country, carbon emissions from the health sector are about 8.5% of the national carbon emissions. So there is an awful lot that we need to be doing within those systems to reduce carbon emissions as part of what we need to do for mitigation. So that requires policies within health systems and at a national level. So it's a little tricky. I think somewhere like the US, where healthcare is privately run for the most part, it's more difficult than it is somewhere like the NHS in the UK, which has done a great job at having national policies around their healthcare systems and reducing carbon emissions through things like their infrastructure, but also through supply chains as well, which produce a lot of carbon emissions for the healthcare sector. So it's easier somewhere like the UK or Australia to have a nationwide policy for public healthcare to say this is what we're doing and these are our standards and these are our regulations. It's harder somewhere like the US, although there are things that can be done in terms of incentives and regulations too, to kind of push that along. Adaptation is another very, very important part of that too. We know that we are already at 1.2 degrees of warming. We're already seeing the impacts. That's not going to change within our lifetimes or far beyond that. So we need to look at what we need to do within healthcare systems to make our communities and hospitals more resilient. So that's things like both Tess and I spoke about social determinants of health and social policies that are addressing the underlying problems that make people more vulnerable. And then it's also things like looking at the resilience of hospitals and creating risk profiles for hospitals and looking at what needs to be done to make those hospitals more resilient now and into the future. And I will speak very briefly about COP. One of the things we saw at COP, which was good, was the creation of a loss and damage fund for countries. So that's providing money to countries to recover from climate change-induced disasters and other things like that. There's a few issues with that. Number one, there is not a lot of money there and a lot of money committed to that fund yet. And we're looking at needing trillions of dollars a year into the future to provide for that fund and what is needed. It's also not necessarily about adaptation either. So it's kind of like when somebody's injured, it's helping them, but it's not preventing that happening in the first place. So there's an awful lot more that we need to be able to commit to that. And what we did not see at COP was increased ambition on mitigation, which is, we need to be treating the cause instead of just putting a Band-Aid over a gaping wound. So that was disappointing. And certainly next year, I very much hope that we see increased policies and ambition on mitigation and trying to get that down to below 1.5. It's what we need.
Thank you.
So I'll agree with what Kimberly's saying. And then I think one of your other questions was health present at COP? And I think the answer to that is yes and no. So yes, in the sense that it's definitely increasing its presence. So there's a World Health Organization pavilion, and health events happening at that all day. And that was new last year. And is really great to see that many people focused on health, and we had a health policy group there that was focused on the negotiations and how we can bring in health into the negotiations. And a lot of people active on this and really excited about it. And there's no question that there's a burgeoning health community at COP and bringing the voices out there. And in particular, the US was bringing in some of their leading health experts from the Department of Health and Human Services and talking about what the US is trying to do, although limited because of the private systems, what we can do as far as addressing healthcare resilience and healthcare emissions. So yes, there were good things, but no, in the sense that there was no formal negotiations on health. There was no formal health day. There's no formal way of looking at health in the negotiations yet. And that is lacking. And I think the more that we look at adaptation, the more that health is going to come into play there. But like Kimberly was saying, the health sector emissions are also a very big deal and need to be spoken about as well. Health sector emissions account for, I believe, around 5% of global emissions. So that's something that needs to be talked about, and I don't think is enough. And I think there could be a bigger focus, and I think it's moving that way, but not there yet.
Thank you. So 2 questions from the chat. One was about if you could speak to the link between food security and nutrition and climate change as one of the health impacts. And the second question was, are you optimistic that we can curb our carbon emissions by 2030?
Tess, I'll defer to you on the food security because that was one of your slides and you can elaborate on that a little more. I'll take the second one though. Yes. Look, I think everybody who works in this space has wavering pessimism and optimism. We still have a chance, and I think that's really important. So we still have that bracket of time when we can make a difference. We're not there yet. We're not on track to be there as we need to be yet, but there is growing momentum in all sectors towards this. There's growing momentum in the private sector, and some of the big emitters, like the US, is developing increasingly progressive policies on this. I am still hopeful because we still have time. If you ask me again in a couple of years, I may change my answer, but I think there are enough people working on this and pushing this that we still have a chance and we can do it.
So I'll speak to a little bit of that, which is that I don't think we're going to be at 1.5. I think we're going to pass 1.5. Although I think we're moving in the right direction, I think that it's very unlikely that we're going to curb our carbon emissions that quickly. And although, like you can see, particularly in the US, significant increases in renewable energy, particularly solar and wind, as increasing in our energy system, renewable energy takes about 13% of the US energy system right now. That is nowhere near where it needs to be. And the amount of infrastructure that needs to be built to actually increase renewables to the amount they need to be at to curb our carbon emissions to net zero of what we're saying is nowhere near it needs to be. So I think the likelihood that's going to happen by 2030 is very low, but I do think we're moving in the right direction. As far as food insecurity, I think there's clearly a climate change related part of this, and then but it's also clearly got a lot of other things going on that are not necessarily climate related. In particular, the war in Ukraine is one that's very omnipresent in our world right now, where we see just the significant decrease in wheat production both from Russia and the Ukraine, and that coming out and leading to increased food insecurity acutely now. So there are other things from climate change itself. I talked a little briefly about this, but we know that heat, although CO2 in the air actually increases some food production because the plants take in the CO2, it's actually making it so it's less nutrition. There's less nutrients within a lot of the different food itself. And this is something that can be adapted to. We can think about changing seeds. We can think about how we're planting and when we're planting. But right now, crop growth seasons are decreasing. I said it was about 9 days for corn, but 1.7 days for rice, 6 days for wheat. All of these growing seasons are decreasing, and that's decreasing the amount of food. And then the food is more nutrient poor as well. So that's contributing to food insecurity. And then heat waves in themselves will make it hard. So we can see there's a lot of statistics on how we have decreased labor because of heat waves. And a lot of this is outdoor labor because people can't be outside working when it's that hot. And I come from a family of farmers, and you can't work outside at that time. And that's going to contribute to it as well. And that's from climate change. But looking at insecurity, food insecurity is such a complex issue. I don't think, just the same way extreme weather is complex, we can't say that it's all related to climate change here and all related to something else there. It's one of the many, many factors.
Thank you. I think we have some questions. So let's see, Drew, if you want to introduce yourself, say your name, where you're from, maybe share a health impact you've seen in your community, and then ask your question. Go ahead, Drew, and then we'll turn it over to Kate.
Thank you. I am Dhruv Bhatt from Uttarakhand in India, and a direct climate impact that I've seen here in my state, which is very water rich, is because of the melting of a glacier and because of flash floods and all of these water-related disasters. There has been an increase in the number of people that are impacted, and not just the health, but also not just their physical health, but also their mental health.
Drew, I think maybe we lost.
Am I audible?
Yes, now you're right.
So the question that I wanted to ask is that in India, there's one doctor per 854 people. And as Kimberly said, there's a lot of authority that doctors have in our society here in India as well. So is there any way that young people can interact, the children and young people can interact with health professionals? Because I'm a child rights activist along with a climate justice activist. So is there something that we can do to work with all of these wonderful, interested healthcare providers to advocate and use that authority? Because I understand that all doctors don't have the time to advocate, but is there something that we can do to advocate using this authority and together with healthcare systems?
Thank you, Drew. So Dr. Wiskel, Dr. Humphrey.
I don't know if we're all freezing, but yes, that's fantastic. I think that's a big part of coming together with the community and with the healthcare providers to show the impact. So we see it from the side of treating patients, but you're seeing it from the side of what it's doing to your friends and family. And I think those people coming together like that and sharing the impacts is incredibly impactful. And although, you have some sort of voice as a healthcare provider on the specific health impacts, saying your own personal story and coming together with the healthcare provider in your community, be it the doctor or be it the local clinic worker or social worker or whoever else, can have a lot of impact in advocacy.
I agree with Dr. Wiskel. So we know that personal stories are really relevant and hugely impactful in terms of communicating the climate message. So making that real to people, making it tangible by using examples, and it doesn't need to just be health related, because it is all intersected and it all comes together. It's using that authority plus those stories as a team. I think if you make it matter and make it relevant to people, then we're much more likely to get momentum and action on this.
Thank you. Kate, do you want to ask a question?
Yes, so my name is Kate and I'm from the St. Louis region. So I'm also here in the United States as well. And so in St. Louis, I've actually witnessed a lot of flooding, and there have been a lot of displaced people. I know just this summer in July, we actually had really bad flooding and people were not expecting it, but it put a lot of households about 10 feet underwater. Of course, that's not a new thing, but people just weren't prepared for it. And so in your guys' presentation, you talked about human migration. And so I was sort of wondering about that because, at least in my area, what I've sort of witnessed is that people will be forced to move out of the regions because their home was destroyed or their business was destroyed. But then corporations or other residences come back into the area and then purchase that land while it's cheap. And then the cycle just repeats itself again, and people continue to build in those floodplains. And so I was sort of wondering from you guys, what's an effective way to communicate with people about those issues and encourage people to just move out of those regions? Or can you guys give any other insight into that type of migration that's due to flooding?
Absolutely. So I think it's very complicated, isn't it? Because as you said there, it's not easy to deal with these things. So we've seen similar in Australia recently, and I'm not there, obviously I'm in the US at the moment, but I very much am in touch with my colleagues over there and I'm aware of what's happening. So we've not traditionally had significant flooding in Australia. We've had flood events, but over the last year or so, we've had significant flooding on the east coast of Australia, where we've had nearly entire towns that have been just completely flooded, and everybody has had to migrate from that region and we're not prepared to do that and haven't been able to move back. So the question, I think, is what it really comes down to is building resilience in areas to withstand flooding versus the decision to relocate populations as well. So there's been some work done that we're aware of in the Boston area and certainly other places in the US and elsewhere to prepare for flooding. So making allowance within communities and building infrastructure that allows cities to live with flooding in a way that doesn't completely decimate infrastructure or force people to move. It's just creating a different urban environment that prepares for that and enabling people to stay there versus having to relocate elsewhere. I think, as you said, it's really difficult because it comes down to policy decisions at a higher level that say, actually, we've made this risk assessment and people can no longer live there, and corporations can't come in and purchase that land and create this cycle that goes round and round. One thing that we can do from a grassroots level is advocacy and creating that awareness of what we're seeing and what we need to do as well. And Tess, I'm sure you have some things you'd like to add to elaborate on what I've said.
Yeah, I agree. And I think one thing that you brought up, Kate, was that this hadn't happened as much in St. Louis before. And I spent some time in the Midwest, and I don't think it's happening as much. And like, there's certain areas that have had floods before, and they're built where what we call upside down houses. So the basements are meant to flood. We expect that flooding to happen. And I think what we're seeing with climate change is, oh no, that's happening in new places and we're not ready. And that's one of the things where we can learn from other places and other communities. And that's one of the things we can learn too from like around the world. So people in Bangladesh, where it gets flooded over and over, have ways where like the houses are built on stilts, where you have movable things. And that's something that we need to kind of bring those lessons learned to other communities. Particularly in the United States, the issue of coming back to the areas that keep getting affected, is that we don't have the right incentives right now. Insurance rates don't reflect the risks of living in a certain place. And this has been an issue politically. And we've more recently been able to put in some policies where insurance rates are starting to go up to start to reflect some of these climate related risks in areas, including the risk, the price of insuring coastline houses, but it nowhere near affects in what the actual risk is. And could that force people out because of the rates insurance? Yeah, if the rates actually reflected how much risk there is in an area, it could. But would it make sense to make them high enough for new housing to be built and new companies to be built so that they're not built in areas that are at a very high climate risk? That's something to think about, and something where we can talk with our politicians, vote for the politicians that are kind of voicing their concerns about this issue and the realization of the issue and their policies that might make sense to mitigate the risk.
Thank you. Next we have Wiskel Bakri, who has a question. You can take yourself off mute.
Hello, my name is Wessel. I am a high schooler from New York City. And I was wondering, as someone who lives in a city with a lot of low-income minority communities that have been historically affected by redlining and architectural inequality, I know you've brought up the urban heat island effect. So I was wondering if you've had any recent conversations about potential solutions to this effect, because it's something that I've sort of had a hard time grasping solutions to because of the fact that it's been so historically cemented into our community structures.
Definitely. So there are a number of organizations who are doing a lot of really good work around greening urban areas as well. And I think there is a little bit of momentum on that. One of the other things that I've seen and can be sort of mobilized from a grassroots level is urban agriculture and really getting communities together with their local areas to advocate for greening those areas and for having things like community gardens as well, which I guess have dual effects. So you can bring that greening into the community, but also emphasizing the importance of social cohesion and bringing people together as well. So there's a book that's a really good book that is about the 1995 heat wave in Chicago. And one of the really interesting things about that is that they looked at multiple communities within Chicago that had similar socioeconomic profiles. And one community, thank you, Tess. Yes, called Heat Wave by Eric Klinenberg. I don't think I mentioned that important fact. So go and get that book. It's very good. So it emphasizes the importance of the social determinants of health and how marginalized communities and those with lower socioeconomic profiles are more vulnerable. But one of the really interesting things is two communities that had similar profiles. One had much better social connections within that community and neighbors who looked out for each other and people who went and sought out people they hadn't seen for a couple of days, had way less death rates in that community than the other community, even though they were equally poor. So that really emphasizes how important those social networks are in protecting those around us and ourselves from the impacts of climate change. And when you're looking at community-based advocacy, such as greening areas, such as urban agriculture, it does bring community together and enhances those social bonds, which have those ongoing effects on really increasing social capital in an area and then decreasing the impacts of climate change. And Tess, you might want to add some there.
Yeah, no, I completely agree. I've worked in a lot of urban areas in America, and we see these effects of like redlining and systemic racism on the health of communities. And it's very clear that the way the cities have been built particularly impacts certain areas. And this is everything from like freeways and polluting infrastructure right next to communities of color and poor communities. And that was forced from racism. So some of the areas I worked in that were very poor in Philadelphia, people would come in and they're like, I just can't breathe. And like, there was no good reason. There wasn't an infection. There wasn't something else, but they're coming in and they're getting the pollutants from the air. And you can see this in the air quality. And I think one of the things, one of the ways to advocate for this is as the health co-benefit. Kimberly talked about this earlier, but if we can decrease the pollution from transportation, move to electric vehicles, move to public transit, move to biking, move to other things, then we're also decreasing the pollution in the city that's impacting respiratory disease and cardiovascular disease and maternal and child health and everything else. So by helping with climate change, you're also helping reduce these other impacts to the community and the impacts that have come from systemic racism and how communities were redlined over time.
Thank you.
Thank you.
Omar, do you want to ask your question? Oh, no,
So thank you. I'm Omar Farooq. I'm 70 years old and I'm from Bangladesh. I work for child rights and their mental health. I am also a climate change advocate. So many families are rendered homeless every year due to floods in our country, due to which they cannot secure the rights of their children. As a result, children worry about their future. they suffer from mental health problems. So what can the government do about this, and what can I do as a child to improve the health of other child? I'm a parliament member of UNICEF Bangladesh, so I really want government to do something to improve children's mental health issues.
I think doing what you're doing right now, which is sharing your story and saying that and how you're impacted, is incredibly powerful. So one of the things at COP at the final plenary session is they brought in a child from Ghana who said more and had more impact, I think, on a lot of the policymakers than a lot of the 50, 60-year-olds that have been doing this a long time by telling the story and what was happening. So I think that's incredibly powerful, bringing that story to your parliament members. And hopefully that way getting the bigger resources you need, right? You know what the problem is. You just said it. People don't have homes. They don't have all this security, and that's causing these mental health problems. You just described it. So, and being that advocate, doing the training like this is the first step in telling that story.
Absolutely agree with Dr. Wiskel. I think those stories are so powerful, and doing what you're doing is absolutely fantastic. So it's making those links really clear. So when you can make those links clear and elevate your voice to the right people, I think when there is enough of you and you're speaking that clear message, it makes a difference too.
Thank you so much. So I have a question. So our program, the FXB Climate Advocates Program, has a very intentional focus on climate solution and optimism, hope, and action. So what are some climate solutions that, we know works? We know that they work, that can impact health and mitigate climate change, that you would share with our advocates?
Absolutely. So I think active transport is a huge one. So this is really why health needs to be talked about in all policies and in all sectors. And as Dr. Wiskel said, I think that was a disappointing thing at COP, was that health isn't integrated into everything, and it should be, because when we're talking about mitigation, when we're talking about transportation, which is a huge part of our carbon emissions, we should not just be talking about electrifying cars. We need to be talking about remaking and reimagining our societies and addressing everything else whilst we're addressing climate change. So looking at the social determinants of health, how can we make our communities cleaner and greener and happier? We should be looking at creating more areas for people to walk by increasing greening and making it cooler and reducing that urban heat island effect. We should be looking at cycling infrastructure and how we can incentivize people walking and cycling, and even using public transport. We know when people use public transport, they usually walk to and from the public transport, and so they get that active transport and all of the health benefits from doing that as part of that journey as well. So for me, one of the big solutions we need to be emphasizing is that move towards active transport reduces carbon emissions, makes us healthier and happier as well. So the transportation sector, I think, is a big one we could be really focusing on as health professionals.
Thank you. As someone who loves public transport, that makes me really happy to hear. Thank you. Dr. Wiskel?
Well, I totally agree with that. But I think another thing we can do, and this plays off the Heatwave book, is connecting communities. And I think framing this as an opportunity to address the social inequities and health inequities, and fixing climate change also fixes these social inequities, is a really big thing. So I worked in the south side of Chicago in medicine there. And for those of people who don't know America, the south side of Chicago has a lot of violence, and it is not a safe place to just walk around in because of the amount of gang and gun violence. And we saw that then during heat waves, during other things like this, those communities are particularly affected because you can't go outside and you're sitting in a boiling apartment that doesn't have other resources. So using this as an opportunity to try to both strengthen communities, to make it where it is safe to go out on the streets and to use other resources and to check in on your neighbors, right? So we know that calling elderly people, your elderly neighbor, can help them. We know that will help maybe get them the resources, talk with them about their medications. I think having people go into the communities and having like community members check in on others and bring in very easy solutions like like water, bringing in cold water, getting people their medicines if they can't get them otherwise. Like we talked about how electricity might go off, something like that. And that's a big impact and has a big mortality impact. So having people help with that and strengthening communities will help address some of the health impacts of climate change and will help address some of the inequities at the same time.
Thank you. So we have a very global cohort of young people from over 30 countries around the world, different parts of the US, and at different different ages, and so different, whether in high school, college, or some who are maybe even getting their master's degrees. So what advice would you give to these young people who are here today, who are just starting on their climate advocacy journeys, as I kind of go through this and interact with the adults in their lives, whether it's like their parents, families, as well as institutions that impact their lives, their schools, their medical providers, and other organizations that they're involved with? Like, what advice or guidance would you give to them in terms of their climate advocacy?
Absolutely. So I think key is that your voice matters. This seems like a very saturated space sometimes, I think, and I've certainly had points in my journey, and I continue to have them, where I think, oh my goodness, everybody in this area knows so much, and I don't know as much. And am I making a difference? And I think everybody has their place, and we're stronger because we're all here. So I always believe that your voice matters. And have a look, I think, as the first sector speaker said as well, is where is your place and what are you good at? So you don't need to do what other people are doing. You can use your power and your voice in this space in your own way. So even within health, we all find that we have a different place where we work. And some of us are focused on greening our hospitals and making them more sustainable. Some of us are focused, as I think Dr. Wiskel and I both are, on improving the social determinants of health within our communities and looking at resilience of communities and effects on vulnerable people. Wherever you find your passion, you can work and believe that your voice makes a difference, and work on your story and really enhancing your personal story as a way to convey how important this is, because it's our personal stories and what brought us into this that makes a really big difference. And I think especially as youth, that voice is really powerful. So make sure that you just get your voice out there.
I think the other big thing that can happen in this space, and again, it's happened to me, is that the amount of problems feel overwhelming, right? We just went over these presentations and like, it's literally every aspect of your life. Like, oh, there's food insecurity and water and heat and transport. Like there's so many different things going on. You're like, but what do we do? And I think that not thinking you need to fix everything, you can pick one part of the problem, and that might be where you want to do your work, and the thing that's most impacted you, and that is really empowering, to not have to think about, I need to fix the whole problem and therefore I can't do anything. Is picking the one part, and it can be through different methods. So maybe somebody is a great advocate. They have a really strong voice. They have a really strong story. They love talking with people. They want to be on screen. They want to be on stage. That's great. Then that's where you should focus your efforts. Become a politician, go that way, or speak with your politicians, speak with the journalists, do that. I'm more focused on science and research. So I want to look more, so I'm, in school again to learn more statistical skills. That's what I'm doing right now. And that's where my focus is going to be. And then using that information to bring it to those politicians and advocates who are better at speaking that way. So I think it's both use your story, but also use your skills and focus on one part of the problem.
Thank you. Someone asked in the chat, do you have any recommendation or know of any initiatives working on the African continent around climate and health that you could recommend for our advocates to connect with?
So just at the conference, we met some of our colleagues in Nigeria who are doing work on populations with disabilities and trying to work with them. And they're working on facilitating like rehab hospitals and how people are particularly impacted by climate change and disabilities there. And I can share with you, one of them has a nonprofit organization she started and is doing work particularly in Nigeria. We have other colleagues at Harvard that are working in Madagascar and working on kind of how the environmental impacts are decreasing biodiversity, and then looking at those impacts on the communities and population around them. But I would say those are a couple examples I can just think of off the top of my head, but I think it's everywhere. So I would honestly try to look more, if you're from a particular African country, at what the resources are in that country. And it may be, that might be the best way to go. Because there's a high likelihood somebody is doing something, and more locally that you can do more on. But I'll see if I can look up those other references and send them that way.
Thanks. You.
And I completely agree with Dr. Wiskel. The other thing that I would say is, you know, yes, absolutely. Have a look at what is being done in your local area, but then also have a look. So one of the things that we can do with climate change is use global knowledge to act locally as well. And so if you've done your scan of your local area and you found out what's happening and you think, oh, there's some gaps, look at some of the global resources that are available on global platforms, available through the World Health Organization, through the UN, etc. Have a look at those recommendations for what we can do for climate action and see what isn't being done in your local area. You understand your context, and have a look at what you need to do to sort of get some of those initiatives in place in your local area as well.
Thank you. And one other question before I'll turn it over to Omar as well is, so many of our students learn about climate change in school through environmental science and through kind of the scientific aspect of it, but climate and health is not an area that students are often exposed to kind of in their like green teams or eco clubs or, you know, any kind of clubs that exist. So what are some resources that you could recommend for students to learn more about connection between climate and health, maybe tools to identify climate impact on health in their communities, any kind of broad resources, and we can then share them with everyone pretty easily, but anything off on top of your head that you can recommend?
Yeah, absolutely. So unfortunately, the link between climate and health is also an issue in places like medical education and our medical schools and postgraduate education, where it is not taught well. So it's not just at you know, sort of the primary high school education level. We've just done a literature search looking at this particular issue and educational climate and health across everything from communities all the way up through schools to postgraduate and graduate education, undergraduate education. There's a lot of resources we've come up with. What I will do is I'll pop them in the chat as well, because there's quite a lot that can get people started on this today.
Thank you. Omar, do you want to ask a question?
So my question is, how can a medical doctor contribute for climate change? Actually, I want to become a doctor, but I still want to contribute for climate change. And that is my question for you, ma'am.
So, like we said, it's kind of bringing in the stories from our patients. I think that's a big part. We have a lot of policymakers or people that I speak with, like when I've gone and advocated and spoken with legislators, who've never seen this. Like they've never seen the person impacted. They've never seen someone die in front of them. And I think bringing that story in as a doctor is very impactful. It's hard because being a doctor, you're being trained clinically. And I feel very confident in my clinical skills and taking care of patients, but it's a different training than training to be a climate advocate. And that's, I think, why both Kimberly and I at least are pursuing this fellowship, in that I'm getting other training to do the research and do the advocacy and do the other things. And I think you can do both, but I think it is definitely, and one informs the other, but it's definitely going to be harder.
Absolutely. Sorry, I'm just finding those resources and popping them into the chat. Yes, look, I think realizing that climate change, if you go into the medical field, climate change will impact your patients no matter what you do. If you're a neurosurgeon, it still impacts your patients. It obviously impacts the patients we see in emergency departments, but it has impacts on the health of everybody all the time. So I think, as Tess said, and I was actually at a conference a couple of days ago, and I had an interesting question where somebody said, if we're seeing these patients, should they be being referred to experts in climate and health as a sort of specialty, which is not something I'd ever considered before. But it comes back to what Dr. Wiskel just said about it is a different set of skills. So I think to work in this area, the things are to realize that you absolutely can, and you can do it alongside your clinical work. So Dr. Wiskel and I have both decided to make climate and health more of the focus of our work than many physicians who work in this space. There are a lot of people I know, and I am on the board of an NGO in Australia called Doctors for the Environment Australia. Most of our members are practicing physicians in whatever area, but they do physician advocacy on the side. And that certainly is something that people can do that doesn't involve them completely pivoting their career to be climate and health. So it's to appreciate that whatever you do, climate and health is relevant, to bring those voices of the patients that you see into that space, and to realize that, you know, with a bit of upskilling, maybe your journey is to be a physician advocate and to just speak up about this with that trusted professional voice to elevate it as well. And you don't need to make it your entire career.
Thank you. Thank you so much. We're really up on time. Thank you for sharing all the resources in the chat. I think they're really going to help students learn a little bit more and dive deeper, because we know today was an overview, but we're really grateful to both of you for sharing your expertise, for making this really seemingly complex topic much more tangible. And I think the lived experiences of our advocates are certainly really powerful, and everyone has definitely felt the health impacts of climate change. So we really appreciate your helping to put us into those lived experiences into context, you know, with data and evidence. And I think this provides many more tools and really enhances the advocacy and the effectiveness of the FXB climate advocates. Thank you so much. And, you know, thank you for sharing your contact information as well. And we'll share the slides and everything with our cohort, with all of the students, so they can, and then if they want to reach out. Over the years of the FXB Climate Advocates Program, we've had a number of students work on climate and health projects. We've had students plant sweet gum trees in the Bronx. Another student started a cooling center in East Boston around extreme heat. Others look at refrigerants and improving the content of refrigerants, as well as we have many students who do reforestation initiatives across different parts of Africa. So these are climate actions, but that have a really great health benefit to community health. So thank you so much, and thank you to all of our participants. It is our last joint session, but we look forward to your project presentations on the week of December 12th. Thank you, Dr. Humphrey. Thank you, Dr. Wilson.